Hello and welcome to this brief introduction to a talk I'm giving at the Swiss Family Doctors Conference in Bern on August 27th. The entire conference is given over to looking at the core competencies of family medicine A to Z, and my introductory keynote is about the core competencies of family medicine. What that really is asking, what is a family doctor? What is a family physician? What is the main role? What is the content of what we do? The educational objectives, the ones I'm going to address, are let's look at what we could learn from family medicine in the past, let's look at what we can learn from family medicine at present, and look at what we can learn from family medicine, particularly going into the future. What's a family doctor? Well, first of all, we look at some of the curriculum development that's been done by the College of GPs, by the Canadian College of Family Medicine, and indeed by the European Wonka Group. But let's move on to ask hard questions, and they are, first of all, are you a good doctor? Are you an effective doctor? Are you meeting the needs of current medicine, and are you ready for the future? So let's delve a little bit underneath those headlines. Are you a good doctor? It used to be that we addressed particularly the aspects of personal and continuing care. And of course, they are very important. And we'll talk a little bit about the works of Dennis Prairie Gray and Franz Huygens. We'll talk about the RCG paper in 1981. And I'll talk a little bit about personal significance, because in addition to clinical significance and statistical significance, the personal significance to a patient is really important. But of course, there's no point in being a nice doctor, being a good personal doctor, if you're not providing effective clinical care. And we have to ask ourselves, are we providing good care, particularly for our patients with chronic illness? So we'll look a little bit about how that evolved to become the quality and outcomes framework in the UK and performance indicators in a number of different countries. They look particularly at chronic disease, but we might ask, do they affect mortality, and do they affect admission for those conditions where there is a quality and outcomes framework target? So we've looked at personal doctor and we've looked at an effective doctor. But is that enough? Clearly at the moment, our patients and politicians aren't happy. There's quite a lot of what we may term doctor bashing in the press. Not only that, but recently I've come across a couple of pieces looking at the effect of personal care, and if possibly personal care could alter your ability to diagnose certain conditions. We look a little bit about whether our education is appropriate, for example, with the wider clinical care of children, and we can look at a number of other clinical areas. Clearly, when we look at all of these things together with the demographics and what's happening in terms of recruitment and retirement in practice, we have what we could call the perfect storm in general practice. And clearly things have got to change. And what we've got to look at is what's going to happen in the future. And general practice in the future may be very different. We may have big teams, we may have different leadership, we may have different outreach from hospital and break down the barriers between primary and secondary care. But the most important thing is not to get hung up on the things of the past, but we really ought to always continue to ask ourselves in general practice, could we do it better?